Doctors and nurses of Reddit, what was the craziest example of someone stupidly making their condition worse? Had a patient come in and had accidentally stuck a chainsaw in his leg the day before. He managed to cut the fibula I think and partially cut the tibia. He put some diesel on it and wrapped it in duct tape and kept working. The next day he steps off something and it snaps the rest of the way through. Came in the front door with his leg flopping bending where it shouldn't be. And to top it off he rated his pain at 6/10. Tough old man. We admitted him to ortho to clean out the diesel and necrotic flesh. The 6/10 part made me laugh honestly. I can't decide whether to believe him or not. Surgical nurse here. Had a patient return to the OR who had some hardware, plates and screws, put in their elbow for a fracture. The hardware was causing them discomfort, so instead of talking to her surgeon they decided to try and remove one of the screws with a knife and screwdriver. I got the case for the wound cleanup and replacement of said exposed screw. One of the strangest ones I've had yet. I saw this young guy in the OR once who had gotten into a drunken brawl with some guys at a bar. When he woke up the next morning, he started getting some vision changes. He said that it was like a black sheet coming down on his left eye. This is a textbook symptom for retinal detachment. Picture an incredibly thin, delicate membrane on the back of the eye, slowly peeling off because of trauma. It's an emergency in ophthalmology because if it fully detaches, you get permanent vision loss. You basically need to immediately go for surgical repair, and then be extremely careful with that eye for weeks afterward. You even have to keep your head down most of the time for the next couple days to help the reattachment process take. So, naturally this guy goes and rides roller coasters all day at the local theme park with his buddies. He first presented to our 2 days later with permanent vision loss in that eye. Six Flags was not worth it, poor guy. They should stamp no carnival rides in indelible ink on such a patient's forehead. It should last as long as need be. Male patient was in for dehydration and other very routine issues. He had an indwelling catheter placed. Now an odd thing about some men is that they cannot wrap their minds around not standing up to pee. So even though he couldn't feel any urge to urinate he stood up to pee, felt the catheter, forgot why it was there, and promptly ripped it out. Now he's incontinent. Another patient was in recovering from surgery. I think it was knee ankle, something that required she use a walker while recovering. She decided not to do that and test her leg. She fell onto the tile floor and broke her hip. My wife, nurse, has seen on more than one occasion a person on oxygen for emphysema blow themselves up with a cigarette. She said, sometimes it's funny, like Wile E. Coyote funny, and they're not injured. But sometimes the injuries are quite severe. My 84-year-old grandma did this last fall. I thank God and every other power that she was mostly fine. First degree and mild second degree burns, especially in and around her nostrils, and some bad memories to have nightmares about, complete with a big black burn on the hardwood floor to remind her. Had a patient with stage 0 breast cancer, decided not to get the lump taken out and instead pursue traditional Chinese medicine. Came back a couple years later with metastatic breast cancer everywhere. Another patient treated her breast cancer with coffee enemas. Spoiler alert, it didn't work. A woman who I was taking care of in labor was having heartburn, and she was sucking on a Quickies to get rid of it. However, she was also sucking on the gas and air at the same time for pain relief. And she sucked so hard that she choked on the Quickies and we had to call a code blue because she couldn't cough it back up. We eventually sorted her out and she was okay and went back to laboring. She did literally exactly the same thing 10 minutes later. Had to call a code again. This was one of the times I really wanted to be able to tell a person that they couldn't take their baby home because they were too stupid to be allowed to have children. I was a nurse for 20 years, but this is a story about my husband. The man has a very high pain tolerance and is always hungry, so one day when I met him for lunch I was worried when he wouldn't eat and said his lower abdomen hurt. I talked to a doctor friend and husband was sent for an immediate CT scan. Husband was sent home to wait for the results. So, being him, felt better and ate 2 chili dogs with fritters. Of course when the doc called and told him to get to the hospital now because his appendix was about to rupture, husband had to be kept in a holding pattern for 12 hours because he'd eaten a big meal. I may have shouted at husband a little bit that day. I am in awe. I've seen my cousin screaming for mercy and or quick painless death when his appendix got infected. Shouting was well deserved. I have a patient with autism whose mum tells him she can heal him with crystals and he has a demon inside him. Whenever she tries to visit him, it's messed him up so much he makes himself vomit, so she leaves. It's super effective. Also, patients who let their dogs lick wounds like ulcers because they think it'll make it heal quicker. It does not. I used to work at an oral surgeon's office. A patient came in needing a tooth pulled and BC the root was near the jaw. They needed to remove it under anesthesia. The patient did not want to pay for the anesthesia, $350, so he decided to try and take it out on his own. He used pliers and ended up breaking his jaw. We had to go and fix his jaw and wire his mouth shut. Ended up costing him $9,000 instead of $500. Doctors have to treat you if you don't have money. Dentists don't. Teeth are apparently not part of your body. Obligatory, not a doctor. I'm an optician and optometrist, and so many semi-blind people refuse to get glasses because they don't want to spoil their eyes. They come back 6 months later with migraines and complain about not being able to drive in the dark or read, and get angry because their eyesight is not getting better although they're always training their eyes. It doesn't work like that. Nurse here. The condition was not worsened by the patient himself, but his choice of life partner certainly did not help. Patient was utterly ravaged by advanced cancer. Several doctors have told him and his wife that his condition is terminal. Patient seemed to understand when he was lucid. Wife said she understood as well. He was in hospice for comfort. One night he had trouble breathing, as the dying tend to do. Wife called 911 against patient's wishes. Thus began a 3-week pointless and painful ordeal that involved life support, dialysis, at least 1 round of CPR, on a man whose bones were riddled with metastasis, and diarrhea. Wife was adamant that he will get better through holistic medicine. On top of being in denial, she was dumber than dirt. She filled the intensive care room with all sorts of new age chocks like inspirational pictures and rocks. She even refused pain medicine because it would, like, dim his chakras. Wife left a crystal geode on the bed. Crystal worked its way underneath patient's hip. Patient developed a raging bed sore that never closed, was nearly always soaked in feces and was a beat dress on a patient who wanted to die and was in already excruciating pain. This was years ago. Still, I can honestly say I hate that woman. The healing crystal pressure sore threw me over the edge. Poor guy. Patient here. I got an itch in my eye one night and figured my contact had dried out. I went to remove it but the dang thing was stuck on my eye. So I started pinching hard, trying to get it off. And then my vision went all wacky and my eye started to really hurt. Gave up and went to the cause I couldn't see. Turns out my contact had fallen out before the whole process started and I'd been scratching the crap out of my eyeball. Had to wear an eye patch and put in some very unpleasant drops for a week or 2. Oops. I had a client with a stroke who received TENS treatment in rehabilitation. Really low electric impulse to stimulate muscles and nerves. After rehabilitation he was offered to get one of the things for home use, completely free of charge costs. He refuses because filling out the paper, 1 page, was too much work. He decided to just use what he had at home, and tried using a transformator transistor for this therapy. That completely destroyed the small amount of nerval function we had archived in rehabilitation and screwed up his condition a lot. Do not try this. This hurts a lot. When I was on medicine wards in med school we had a patient with a Zenker's diverticulum. It's essentially a weak spot as his esophagus kinda makes an outpouching where food and liquid get stuck. He can then regurgitate the food and aspirate, leading to pneumonia and other bad stuff. We were the primary team and Serg was going to take him back to the OR on Friday. Thursday night he eloped and no one knew where he went. He came back Monday to the ED and got readmitted. When we asked where he went he said there was a big food festival that weekend that he didn't want to miss, so he went. Instead of getting the surgery he needed he left to go eat fatty and thick fried foods which literally could have killed him. My mom's current BF has oral and throat cancer. Guy literally has a stoma and no tongue. Was still smoking around 3 packs a day until recently. Mill got diagnosed stage 3 lung cancer, quit smoking and drinking for a couple of months. As soon as doctor said her condition was improving, she went straight back to smoking and partying. Only took a few months for the cancer to get to stage 4 and spread to her liver, kidneys, and brain. She smoked up until a couple days before she died, and even then only because the brain cancer caused her to lose control of her limbs and she physically couldn't hold a cigarette anymore. It was so sad to watch. I'm incredibly proud of my husband though. He quit smoking with her to help support her and never started again even after she did. Said he never wants our girls to have to go through that with him. Not a doctor, but I had a stress fracture in my foot that had to be surgically corrected. I was given a 60-day supply of Vicodin, but my now ex-husband was a recovering alcoholic who had me convinced that I was going to become horribly addicted if I took them for more than a couple days. So I began taking a leave because it was stronger than Tylenol and I only had to take one a day. My foot was very slow to heal. Like a couple months go by instead of the usual 6 weeks. I had to get a CT scan. And I was very worried because this small little fracture just wasn't healing. My doctor asked what I was doing for pain, and I told him about the Aleve. Turns out NSAIDs interfere with bone healing. I cut out the Aleve, and my foot healed a few weeks later. Your ex obviously produced a peer-reviewed study researching. Ha 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 ha. Work comp adjuster here. Had a claimant completely disappear after a surgery was ordered. Fast forward 2 years and he gets an attorney who demands the surgery be approved now. After months of back and forth, we approve the wrist surgery. 2 days post-op the police find him walking down a county road, blasted out of his mind on M, ripping out his stitches. Apparently he went on a binge and just tore apart his surgical site. Doctor dropped him, his attorney dropped him, the state basically closed his case. The last I heard was he got out of jail, grabbed all his meds from home and disappeared again, but never followed up with the doctor. I cringe to think what his arm looks like. MD. Here. Had a patient who was found unconscious and taken to our hospital. Turns out he was diabetic, unbeknownst to him, and went into a coma. We got him straightened out and sent him home with insulin. Fast forward a week or two and he comes into the ER for vomiting, dehydration and blurred vision. He hadn't been taking his insulin since only really sick people need insulin. Well, he's technically right. We see a lot of people who get a common rash like eczema or some other unspecified dermatitis who very sadly convince themselves that they have bugs or worms or other creatures in their skin. They dig at their skin, pour bleach on themselves several times a day, or even cut themselves into the skin to try to dig these non-existent parasites out. In doing so, they hurt, sting, itch, and suffer more. Some isolate themselves from family and friends, fearing they'll spread a non-existent infestation. It's sad. Not a doctor, but my sister and I go Christmas shopping. She's newly pregnant. I can tell she's in pain and it's getting worse. She claims it's just gas. She thinks all stomach pain is gas. I offer to take both carts to check out while she sits for a bit. At this point she's vomiting. I'm pretty worried and tell her I think we need to go to the hospital. She insisted it was gas and she had a doctor's appointment the next day, so she'd mention it. Next day, she has ultrasound before OB appointment. 5 minutes and she calls me and says she doesn't know what's happening, but they told her to get dressed and not to move. She hears them call an ambulance. Ruptured ectopic pregnancy with internal bleeding. She's fine though. Ended up pregnant again 2 months later with my nephew. But she still doesn't learn. After weeks of her sick and looking like death, I convinced her to go to her doctor last week. She has pneumonia. She was probably in denial about losing her baby. Glad she got pregnant again, but I'm sure she still feels that loss. But also she does just sound kind of stupid about her own health. You don't just miss pneumonia. Homeless man came in the ER with a small cut on his scalp. Doc stitched it up, but he went back to sleeping in the gutter. Never came back for his checkup a week later. 6 months later he showed up with an entire colony of maggots living under his scalp. No. Oncology nurse here. Had a patient with a relatively treatable cancer fail to tell us about an herbal cure that his son bought for $300 a bottle. He was taking it while getting chemotherapy. He wound up basically shutting down his liver and kidneys, hospitalized 4 weeks and delaying treatment. So yay, the cancer spread. System too weakened to resume treatment. He's dead. And all because of the snake oil cure. Sad that families spend hundreds to thousands of dollars out of desperation and wind up causing more harm death. Buttholes that promote these cures for profit need to be sued. Not stupid, but just plain confused. Grandpa admitted for pelvic distension, pyelonephritis and UTI secondary to urinary retention. Urologist places a Foley catheter in to relieve his bladder and drains 3 gallons of urine in one sitting. Grandpa gets a good day's rest and all goes well until one night we find him standing butt naked in the middle of his room with his penis oozing a pool of blood at his feet and the catheter, with a balloon still inflated, clutched in his fist. He had a very calm "what are you all looking at" expression as we reacted in horror. His nurse quickly calls the urologist again and he places another Foley catheter with orders for continuous irrigation and to transfuse a unit of blood. Kept him longer in the hospital than he really needed to be. Nope. Stop. My penis is now a raisin. I'm an animal nurse, vet tech, and had a chihuahua come in that had been limping. The owners had been giving him ibuprofen inside of pieces of chocolate. It was certainly a self-inflicted condition. Old guy in for rehab after some kind of orthopedic surgery, taking warfarin for DVT prophylaxis. His INR, a clotting time test basically, was coming back out of whack time after time despite dose adjustments and nobody could really figure it out. Went in his room on some routine task and saw a large pill bottle on the dresser. Turned out to be an herbal supplement containing, among other things, garlic, ginger, and if I recall correctly ginseng, all of which interact with warfarin to make it more effective. Guy's wife took pills home. Guy lectured on "please run even OTC meds past your doctor cause you absolutely did this to yourself." Labs normalized. Geez, I have to stay away from herbal teas because of warfarin. What an idiot. Contact lens wearers, please do yourself a favor and take out your contacts when you're told to. I had a patient who came in and she thought she scratched her eye taking her contact out. When we looked, she had a gigantic ulcer on her eye. Yes, like a canker sore that you get on your mouth can be on your eye. Ulcers, if deep enough, will eventually scar. Depending on where the ulcer develops, will determine if there is any long-term damage done. I would say if the ulcer was about 0.5 mm to the left, the patient would have lost some of her central vision. She already had 5 ulcer scars in that eye and 8 ulcer scars in the other. This was not her first rodeo. Turns out, she sleeps in her contacts every night and throws them out about once every 3 months to save money. A year's supply of her monthly contacts was $120. That one office visit alone was about $100 plus about $200 for a tiny bottle of medication to treat the ulcer, not to mention a copay for her follow-up visits. Of course, she has no backup glasses and obviously can't wear the contacts with an ulcer, so she also had to pay to get a quick pair of glasses made. About another $400 setback. Contact lens wear time is not set to make more money for the eye docs. Your eye will literally develop a sore to tell you that it needs to breathe. Please help out your eyes. I don't know how anyone can sleep in their contacts. It feels like when you wake up and your mouth is so dry not even the tears of Jesus would quench your thirst except it's your eyeballs. I had a little old lady come in complaining of coughing up blood. She was spitting up huge clots of blood every few minutes and had pain in her throat. I asked her if she had done anything for the pain. She told me, "Well, I smoked some crack." I asked her if she normally smokes crack. She said, "No, I'm a drinker, but I thought it might help." Moral of the story, crack will not help you with anything. IQ nurse took care of an 18-year-old who got into a fight with his mom about not letting him borrow the car that night. He got so mad he rammed his head into a wall, giving himself a brain bleed. He woke up out of surgery and his mom had to prompt him to acknowledge the neurosurgeon who saved his life. All he said was "appreciate it." I caught him taking pictures throwing up gang signs in his craniotomy cap. Just so dumb. Not a doctor or nurse, but my sister was diagnosed with acute hemorrhagic pancreatitis when she was 16. Causes crappy genes. She cannot eat anything with fats. When she was discharged after an almost 1-year stay in the hospital, she sneakily ate a small chunk of fried pork. Goddamn, we were immediately thrown back to square one. Thankful that miracles happen twice. Nursing student here. Female patient had an indwelling catheter to help void her urine. She had fluid overload from heart failure. I was at the nursing station giving my co-signed nurse a report when I saw my patient walk up to us and start speaking to us in Greek. It took me about 2 seconds to realize that she didn't have her walker with her. Another 2 seconds to notice she didn't have her catheter with her either. I walked her back to bed and saw the catheter attached to her bedpost with the balloon still fully inflated. I'm going to go wash my brain out with soap now. And maybe sit on an ice pack or two. My bits hurt just reading that. You just have to keep reading in order to purge the previous stories that made you recoil. Eventually you'll get to a point where you come to a story that doesn't make you flinch as much as the others. Quit then. Thanks for the checkpoint. I'm getting out of here. Not a doctor or a nurse. Just the niece of a man that, after having a surgery performed on his gut and being told not to eat anything for the next 24 hours, decided to get chili cheese fries at Wendy's on his way home from the hospital. He went right back and his condition worsened. Also, my fiance's mother is a nurse and told us that a man came in once with a tiny garter snake up his urethra. It had been there 4 weeks before he came in because he was too embarrassed to admit he let the snake go exploring on purpose before it got stuck and died inside of him. So he promptly died of septicemia. I have had enough of this thread. I had a patient the other day come in totally altered, with a blood pressure of like 73/45. Turns out he took his blood pressure at home and seeing that it was elevated, decided to take his blood pressure medications. The thing is, he had never taken these medications before, one being prescribed in 2016 and the other in 2017, by different physicians, who didn't know about the other prescription. After we got his pressure up and he started talking sense, he started complaining of a terrible headache. I told him, well yeah, you have a headache. You just underperfused your brain for who knows how long. You should be thankful you don't have brain damage. Moral of the story, always tell your physician all the medications you are prescribed, whether you take them or not. Woman came in the OR to get her foot amputated. She got into the OR and cancelled the procedure because the walls were green. RN. Take my advice. If you are a fragile diabetic with end-stage renal disease, don't do C. Just don't. Mid-20s female with a less than stellar outcome. She died. I spent literally years putting her into ICU because of her own crappy decisions. She was a frequent flyer in my ER, so it was only a matter of time until she put herself into a hearse. I mean, I feel doing C is unhealthy regardless of whether you're diabetic or not. But yeah, no, don't do that. He had chest pain, so he took some C. He may or may not have been having a heart attack before he did the coke, but he was definitely having one by the time I saw him. C puts a lot of stress on the heart and can cause heart attacks even in healthy people. This guy ended up okay, but he either gave himself a heart attack, or he turned a small heart attack into a much bigger one. Even when I was in active addiction, I never used C because I heard it could cause your heart to explode. In hindsight, it was probably a good thing I never did coke and also got sober because I found out shortly after that I have a congenital heart defect and had spent most of my life in heart failure. I don't consider this all that crazy, but it happens a lot, so I want to warn people against it. I used to work in the ED and would occasionally see patients who had had a bad fall several days prior and had hit their head. Rather than go to the ED immediately, they usually choose to treat their ensuing headaches with a painkiller. The older generation seem to prefer aspirin. The thing about aspirin is that it is a blood thinner, so what would have potentially been a small concussion was then a life-threatening and often life-altering condition. Don't treat pain with aspirin. Recently had a patient with diabetic neuropathy, numbness, tingling pain in your feet because unchecked diabetes ruins your nerves with time. Pour hot honey all over his feet because he thought it would help. He ended up having third-degree burns all over his feet requiring multiple skin grafts. Needless to say, he still has neuropathy. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.